guys. So we're going to go ahead and get into OSA. Okay, OSA is obstructive sleep apnea. Okay, what that is the muscle tone in your nasopharyngeal area, it starts to decrease. It decreases as your patient falls asleep. Okay, it decreases and it relaxes. It overly relaxes, and it causes a contraction of the airway, which leads to those periods of apnea. That apnea, that's the periods of where they're not breathing. Okay, and it's intermittent throughout the night. All right, it usually lasts for maybe 10 to 20 seconds, but it varies, and it causes an airway obstruction. Okay, so air is not getting in and out of there. All right. Obesity is the greatest risk factor for OSA, and it is most common in males. Okay, males usually between the age of 30 and 69, but it can vary. Okay, it can vary. This can also lead to or increase the risk of patients developing hypertension. Okay, particularly if they have a more severe form of OSA. It could also cause cardiac arrhythmias, heart failure, stroke. Okay, this can also impact the health with patients that have OSA already. If they have pre-existing conditions such as like neurocognitive deficits, OSA can make it worse and speed up the progression of those. We need sleep, okay? We need an adequate amount of sleep. It can also lead to like daytime drowsiness, okay? Causing motor vehicle accidents and all of that because they're not getting a good amount of sleep or adequate sleep, okay? You want to be mindful of depression, insomnia, and those type of disorders as well. Okay, there are many different factors that can contribute to OSA. I mentioned the obesity, but even anatomical factors like having like that, being born with a fat neck, okay? Being born with a fat neck, loss of teeth, okay? Muscle dysfunction, because these are muscles in here. So if they already have a muscle dysfunction, okay, that can raise up the risk as well. So you're going to be mindful of that. Other comorbidities are the stroke that I mentioned, dementia, heart failure, and edema already can contribute to OSA. So just be mindful of all of that with your patients that have OSA. So what is it going to look like? Okay, what does OSA look like? Definitely some snoring. Okay, definitely some snoring, and those periods of apnea, what they're gonna if they snore, more likely they're gonna snore. They're gonna be like. Okay, and those periods of apnea again can last for about 10 seconds or longer. Okay, and definitely some daytime sleepiness. How we're going to diagnose this is a polysomnographic test. Okay, that is how we're going to diagnose it. It's usually conducted in a sleep lab. They do have overnight polysomnography exams that can be done at home, but if it's abnormal, they're going to have to go back into the sleep study, or go back into the sleep lab and have it done in the sleep lab anyways. But that's how they would diagnose it. Okay, they pretty much monitor you, put you on a monitor while you're asleep. You definitely want to be mindful of environmental factors, okay, making sure they have an effective sleep environment for them to be able to sleep, okay. Be mindful of some medications that cause sleepiness. Okay, and then also how it's treated is a CPAP machine. They have a CPAP machine and a BiPAP machine. Okay, compliance with their CPAP machine at night is key. Okay, this is how they're going to kind of stop those periods of apnea, because your CPAP machine is going to force the breath. Okay, it's going to have this pressure, and it's going to be at a constant set pressure. Okay, during the period of inhalation. All right, the pressure is relieved during exhalation. So when you inhale, the CPAP machine is putting pressure to force the breath down into the airway. Okay, so even if your nasopharyngeal and your airway is overly relaxed for these patients, these OSA patients, it is. But even if it's overly relaxed, when that patient's head tries to take a deep breath, and say the apnea is setting in and they're about to, the pressure from the CPAP machine is going to force it down into the airway. Okay, not harmfully, but it will force it down into the airway to allow them to continue breathing at night. Okay, so be mindful. I mentioned medications as well. Medications that affect the CNS system or that make you drowsy and sleepy, you definitely want to be mindful of those meds. Even the medications that cause weight gain. We said obesity is one of the main risk factors to this. Okay, patients getting inadequate sleep, that can also have a negative effect on the treatments. Okay, your first step with clients that have OSA is education and behavioral therapies. Okay, encourage your patients to avoid the risk factors, avoid smoking, avoid alcohol, avoid sedatives if they can help it. Okay, avoid those things because we know smoking, depending on what's being smoked and what's being drank in the forms of alcohol, they can also make you very sleepy, right? So it affects your sleep. Sedatives affects your sleep. So you want to be mindful of these things. Your role as the nurse is to educate your patient. Okay, educate your patient on all of those. Educate your patient on the impact that obesity is going to have on them because they are now diagnosed with OSA. Okay, positional therapy is also strongly encouraged. What position your patient is in when they're sleeping. Okay, that's something else you want to take into consideration. And that's pretty much it for OSA. OSA, I feel like, is pretty simple. So y'all got this. Happy studying.